I'm Dr. Blanche Grube. Today I'd like to talk about cavities. And I just don't mean cavities in teeth. People think that that's the only place you can get a cavity is in your tooth. They're absolutely wrong. There is such a thing as having a cavity in your bones. Some people call them cavatations. How does a person get a cavity in their bone or a hole in their bone? Well, most of the time it occurs when a tooth is taken out and the socket didn't completely heal. Well, there are a lot of steps that happen after a tooth is taken out, and if one of those steps doesn't go correctly, that bone will not heal. Number one, when the dentist gives you anesthetic, most often the dentist gives you anesthetic with epinephrine. Epinephrine is a chemical that is actually made by the body, but it's also synthetically made and placed in all of the corpules of anesthetic that the dentists use. Well, not all of them, most of them. When a dentist gives somebody an anesthetic with epinephrine, it causes the blood vessels to contract. Well, that's a good thing because then the patient stays numb for about 2 hours and the dentist can continue working. But it also causes the little capillaries to close so much that some of them close completely flat. And then you can't get any blood cells going through that capillary. Well, if the capillaries don't have any blood cells going through them, then the cell at the other end that is waiting for oxygen to come is never going to get that oxygen. So what happens is a lot of those little bone cells that are waiting for oxygen die off. I once asked a leading pathologist in the United States, a bone pathologist, just how long can a bone cell go without oxygen? His answer surprised me. He kind of hemmed and hawed a little bit and he said, about 30 seconds. That's a lot shorter than I can go without oxygen. I think I can hold my breath for about 1.5 minutes. Maybe. I'm not sure. But I know my bone cells can only go without oxygen for 30 seconds. So if a dentist gives you anesthetic with epinephrine, you're going to have some bone cells that are going to die. So then the dentist goes ahead and takes out the tooth. When that happens, you've got lots of dead bone cells around there. Well, the top of that socket may heal over very well. There's lots of circulation up there. But the bottom of it is not going to heal at all. So 20, 30 years later, you may have had your wisdom teeth taken out 30 years ago. A dentist can actually look on the x-ray and see a hole in your bone marrow where the tooth was, but it never filled in properly with normal bone marrow. We call that a cavitation. So what's so bad about a cavitation? Well, because it never filled in with bone, and because it's still an empty hole, there's room for anaerobic bacteria to set up housekeeping. The same kind of bacteria that actually live inside root canal teeth. They can set up housekeeping right along the walls of that socket, never get bothered by white blood cells, never get bothered by any circulatory problems because there is no circulation in there. But they produce toxins, their concentration increases, the concentration of the toxins increases, and via osmosis, those toxins permeate outside of the cavitation and enter into your bloodstream. That can cause a problem for you. So people have all kinds of problems, and very often it's because they have a chronic infection in their jawbone that we call a cavitation. The cure is very simple. It just means going back into that same hole, rotor-rootering it and cleaning it out again without epinephrine, allowing the socket to heal by bleeding again, all over again, as if that tooth had just been taken out that day. We allow it to bleed, let it bleed a lot, let the bacteria be washed out, and then close it up again and allow you to form a blood clot. Like I've said in other videos, the best thing in the whole world to make your bone is your blood. If you form a good blood clot, chances are you're going to form good bone too out of that. But it has to be cleaned out thoroughly without the use of epinephrine. There's another way that people get cavitations. You can get a cavitation by getting punched in the face. If somebody's a boxer or even a hockey player, or even a basketball player, you can get an elbow right to the face and cause a lot of bleeding internally. Once your jawbone starts to bleed internally, that also prevents blood from flowing through the blood clot to the capillaries on the other side, and that can cause bone cells to die. So it's another way that people can get cavitations. Again, the cure is to go in, rotor-rooter this hole, allow it to bleed again, and then allow it to heal normally. So how can a dentist tell if you have cavitations? Well, our number one tool is an x-ray, a very good x-ray. If a dentist is well trained, the dentist can look at the pattern of the bone and tell if the bone has not filled in properly. There are also machines called ultrasound machines that can tell if the sound waves going through the jawbone are as normal as they should be. And so these are the kind of things that we use to tell if the person has irregular or abnormal bone marrow filling in. This is something that has to be done by a dentist. It's not something that you can figure out for yourself.